At 6 o'clock, so I just want to announce this meeting is being recorded. So this is a Thursday, November 6, 2020, an emergency special meeting, remote participation. So I want to read the meeting notice and explain a little something. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found in the Office of the Attorney General's website. Draft meetings minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, Chapter 30A, Paragraph 20, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting and a listing of topics that the chair reasonably anticipates will be discussed at the meeting. So for today's meeting, we're not going to be discussing the minutes. We won't have any public comment and we'll take no votes except for adjournment. There was a miscommunication, and so the agenda was not stamped and posted before Tuesday. I spoke to the relevant people, and Michelle said that I could have an emergency meeting due to the fact of the COVID crisis, and that would be our only discussion. The AG and I's office spoke, and we batted it around, and I decided to convene the meeting because of the COVID crisis. So we won't be hearing any of the director's report, except if it pertains to COVID. We will take no votes except for adjournment, and there will be no public comment. Anybody have any questions? Okay. COVID discussion. Tammy?
Kate, do you think you want to give a highlight of the numbers and everything first?
Sure.
Kate, I'm sorry.
Okay.
So,
That's
Kate,
okay.
no, that's okay.
Is that all right?
Yeah,
I think it'd be a good, let's
yeah.
start off where we
I
are.
mean, me.
Okay, so there's bad news and bad news. Just so you know. So currently, we are at 102 positive cases since March 1st. We currently have had 10 positive cases in the last 10 days. We are working with 11 households that are in either isolation, quarantine, or both. Isolation cases currently are 13, and quarantined are currently 19.
Hospitalizations?
What's that?
Anybody in the hospital?
Nobody's in the hospital.
Okay.
And nobody has passed.
Kate, what's the difference between quarantine and isolation?
Isolation just means they tested positive. Quarantine means they are not positive, but they need to stay away from the positive case and quarantine away from them.
Or they come in contact with the positive case? Is that correct?
Well,
Okay.
try to avoid that. Yeah, separate bathrooms, separate bedrooms, staying away for, meals, basically not meeting that close contact definition, if you will. So some households cannot do that, unfortunately. So they all have to live in the same area, or shared areas, if you will. And so they are still in isolation and quarantine. It just means different things if there are students that are in the home and how they return back to school. So it can be extended And there's some different rules around students returning.
Kate, is there any common denominator with these new cases that you can share with us?
I have absolutely no idea. The only thing that I do know, and it takes a lot of time because people are very hesitant to speak, is there was a household, I would say, I guess it was I'm going to call it a gathering in a home, family members. And so there were 5 in one family and 6 or 7 in another. And one person was COVID positive the next day. And so now you have all those contact cases. And in one family, there's now 2 positive cases. The other family, there is 1 and continued test. So that's, and more testing is being done in the larger family.
So you would expect all 11 of these to become positive at some point?
Not necessarily. Right now, the bigger family out of the 6, 1 is positive and 1 is negative.
Okay.
So it's hard to say. And
I
they should have been quarantining since November 1st.
I have a question. So since our last meeting, we had almost an increase of about almost 20 positives. Do we know how many of those are asymptomatic?
Before they got tested? You mean?
Well, that are positive and they're asymptomatic and they got tested.
I don't know that off the top of my head. I'd have to look at my data.
Okay.
Most of the contact people are asymptomatic. Then I have a few that are getting tested and then they're becoming symptomatic. So they're getting exposed and then they're getting symptomatic 5, 6, 7 days in.
Okay.
So the chickens have come home to roost in Southwick?
Yes, sir. Yes, sir. They have.
You want to explain the 10 plus 14 now?
Oh God, you really want me to do that? I
I
can.
think you
She
can
does.
explain it better than me.
Okay, so and this is specific to the school district. Okay, there's different rules that have come out from DESE, the Education and Secondary Education Department. And so what happens, this is very interesting. So hopefully I'll explain this. So there is a mom in the home, for example, and she is, and I'm just going to use these dates from the example. She is infectious March 17th and March 18th. Okay, so it's 2 days before symptoms and then infectious 10 days after that. Okay, so there's a window, if you will. Mom gets symptomatic, fever, cough, headache on the 19th. So now she's going into isolation. Day 1, day 2, day 3, blah, 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 blah. And then if there is an inability so that would be the first 10 days. Then if there are kids in the home, okay, and now they're exposed, right, continuously, they can't quarantine because of the family situation, then we start their quarantine with the 14 days. So they're basically out of school 24 days. And it gets very complex because you're looking at a positive case with a parent. That child is exposed, okay? And then if they can't quarantine properly, then we add another 14 days before they can go back to school. And hopefully in that time frame, they get tested. Even if they test negative, they can't go back to school.
As of Monday, school is closed.
Oh yeah.
Remote.
Oh yeah.
And
They're
it'll
going
open
remote.
back up at some point.
They're going remote. That's right. So it gets very complex with the school kids. And we look at every family differently and uniquely based on their situation and when we apply this rule. Because some families have larger homes, some families do not. And we ask them, can they appropriately and safely quarantine and isolate? And if they can't, then we apply this rule for safety because of the infectious period.
So the governor, now is this a statewide mandate or is just the Hampden County mandate now?
No, this is DESI. This
No,
is
I'm talking
this is
about the
state.
remote. Is this for the whole county?
Oh, no, just our town, our district.
Or just,
The memorandum of understanding that they had with the teachers union was if the county positivity rate, is that positivity rate, went above 3%, that the district would go remote. And it is at 3.74 as
now
of
is
yesterday.
Westfield remote? Yet?
No, they're not.
They're not. Okay,
But it was part of our agreement with the teachers union.
that's almost the same as,
Agreement.
it's almost the same as spraying for mosquitoes and not expecting them to come in from Westfield or Granby. Is that a good analogy?
Well, it gets complex when you have out of school kids, school of choice kids.
Okay, well, you do the best you can.
Yeah, exactly. So it does pose some challenges, and we work with our public health nurse. You know, we work with anybody and everybody that we can. And for example, I'll just give you an example. When I calculated our percentage rate for October, it was 3.4%. So we had a huge jump in that month. So I'm not surprised, you know, that the county is also higher. And the weekly report that was supposed to come out today at 6, Tammy, I think, right? 6
Well,
o'clock?
first it was 4, then it was 5.
Right. And
I
now it's
stopped looking.
tomorrow.
Oh,
It's
so it says
tomorrow.
it?
Yeah,
It just,
tomorrow.
it's 1,716 cases yesterday. It just
And
looked-
in the state?
Yeah.
Through the state, yeah.
Oh,
Good
I can.
question.
No, we're resurging for sure,
Oh, yeah.
sure.
How do you calculate the positivity rate?
Oh, I look at tested versus positive.
Oh, okay, and figure it that one.
So, yeah, just to give an eyeball of, I don't look at the whole population. I look at the population tested. And there was almost 600 people tested in October. So, and I think there's close to 4,500 people that have been tested since the beginning. I could be wrong on that. Let me just double check. Yeah, it's close to 5,200. 5,200. So that's over half, if you think about it.
Do you know how many people have been tested in Southwick?
That's us. That's us. Almost 5,300.
So, how many, that doesn't show how many people, for instance, have been tested twice, multiple times?
They only count first time.
Okay,
I have not seen, obviously some people get multiple testing every week, but they only count the first time of a positive test.
okay.
And I have not seen any repeats. So for example, if someone got sick in April, tested positive, and then retested September and was positive. I have not seen that.
Anybody have any questions for Kate?
I do. Sorry. Did you say 2,600 people were tested in October?
No, almost 600.
Almost
582. Yeah,
Okay.
582.
Okay, thank you.
Sure.
I put up the last COVID dashboard. And
That's
what I
good
thought
for
was
me.
really interesting was if you look, you might need to move your panel, your gallery, but the total cases by age group is almost completely flipped from what we would have seen even in probably May or June.
Mhm.
You've got
Oh,
0 to 19 years is the largest group we've had in the last, is that the 2-week period? Yeah. Or 1 week period, 1 week period.
does it surprise anybody that coincides with schools opening and people going back to work because they don't have to stay home with their kids and the colleges being back at school, back in class? Is anybody shocked at this?
Just wanted to show it.
I mean, I guess I haven't seen evidence of positive in that age group yet, but I know that the couple that I have seen in the 17 and 18-year-olds have been quite sick. And that's only in the last week. Like I have family members texting me that they're going to the ER.
Wow.
So whether that's a trend, hopefully not a trend in Southwick, but obviously it's looking that way in the state.
Let me see if that's the trend by age group.
Mm-hmm.
It's much bigger over here.
Oh boy, that's busy, huh? Yeah.
I know, huh? I thought the county one was on here too, but I don't think so. I don't understand a lot of these, to be honest.
Yeah, they're really intricate. So other questions for me?
Sue?
No.
Jean?
No, I'm all set. Thank
Doug?
you.
Doug or Joe?
Not for me.
Jamie, how are you doing on money? Are you okay? Do you need anything from us?
Well, we finished our public health grant. We rounded it out probably 2 weeks ago. And now we just are using the CARES Act funding to pay for any time or supplies that are needed. Which that we have that. It's definitely great that we're able to get that. And now that they found coverage for the extra 25%, at least the town will be reimbursed for all of those, for all the expenditures on that. Because at first it was just the CARES Act is 75%, and now they did the extra 25. So
Great.
that's pretty.
Okay, thank you.
No problem. But so I definitely wanted to make sure we had a meeting. This week was lots of new information came out from the state, from DPH, and from the governor's office, and I just kind of wanted to go over some of those things that have come up. I think most notably were the 3 separate orders that came out on Monday, and they're going in effect tomorrow or at midnight, basically tonight. The first one is the revised order requiring face coverings in public places. It's not too new in what it's saying, except now we've expanded where people have to wear masks, and basically it's in any public place, in any public area. So regardless of whether or not you can social distance or you're in the fresh air, it is masks. Period. You're going to the track, have your mask on. You're doing some sort of work outside, maybe going to the transfer station, you have your mask on. So it's all masks all the time, except where the medical exemptions apply, and except for in certain types of workplaces where the workplace standards allow for social distancing. But other than that, that's the main one. One of the things that was a popular part that was put into this order is the allowing employers and schools to request a letter from people's notes when they ask for or claim the medical exemption for not wearing a mask.
On a public place, for instance, like Big Y.
That is what Big Y would only ask that of their employees.
Not of the public.
Not of the public. These are employers and schools can ask people to have proof that they can't wear masks for medical purposes.
The reason I asked that is I was at Big Y today and I asked one of the employees I know, and she says she has only one family that comes in without a mask out of all the people that she's seen. and she's full-time. So there's fairly good compliance, I would think. So anyways,
Well, I'm hoping that the extras, you know, the coverage of the masks and
you know, all over the place kind of gets people maybe a little bit out of the mask fatigue that they've had, you know, kind of to remember that, oh yeah, there is a reason why we're doing this. So I'm hoping that we'll see a good result because of that. Let's see. So then the next order that I'm going backwards, but I feel like I'm going backwards only and I'm starting with what I think was more important. That was 53. This is 54. No, that was 55. This is 54. Order number 54. So the revised order further regulating gatherings in the Commonwealth. This is probably the one that I have received the most phone calls and the most emails on because a lot of people didn't really understand it when they first heard it. The main part of it is that, or the biggest difference is that at gatherings at private homes, so your Thanksgiving dinners are limited to 10 people if you're including people outside of your household. That was the biggest one. These are not private events at like a banquet facility or those such things. This is just on your private residence. And that was kind of one I've gotten a lot for. As for the gathering numbers for events out either indoors or outside at public spaces or, you know, rental facilities, that didn't change. It's still 25 persons max at an indoor event. And depending if you're a step 1 or step 2 community, so we're still a step 2 community, it's 100 at an outdoor event, and then it would be 50 if we go back. If we're in the red for 3 weeks, it would go back to 50 at an outdoor event.
well, we're still in the green or yellow or what?
We won't know till tomorrow, unless you see it on there. But we'd have to be in the red for 3 weeks to have to go back,
Okay.
to roll back. So
Kate muted, she was gonna say something, so okay, I'm sorry.
it still political gatherings, religious activities aren't subject to these gathering sizes.
Except as for the building, except what the building can hold, is that correct?
Yes. So like if these were outside, you know, you wouldn't be, the 100 persons wouldn't be required.
As long as they can socially distance, is that right? Or
Yes, we're still socially distant and face coverings. Face coverings is also part of the order. So
and inside they have to limit to the building capacity, even if it's political or religious?
Depending on the type of place or event. Yep. So you would still have to go with the 10 per 10,000 square feet. 10 or 1,000 square feet. Sorry if I don't have that memorized. If you're indoors, if there isn't a building capacity. And then there's a time limitation. So no gatherings, no matter the size or location. All gatherings must end and participants must disperse by 9:30, except religious and political gatherings. There's exceptions for legal bodies and obviously things like polling places and stuff like that. So that one was pretty big. I think a lot of people really got nervous about it because they didn't understand it. So, but just part of what I've been doing is helping people figure out what this all means. Any questions on that one? So the most confusing one is probably order number 53, which is the order requiring early closing for certain businesses and activities, limiting hours for alcohol and adult use cannabis. So, like the number one thing.
Hey, hold on for a second.
Okay.
So I just got this from the DPH. They must be sending it to every household. anyways. Okay, anyways. All right,
So there is a mandatory nighttime closing period for certain businesses and activities. So this starts at, at 12:01 a.m.
tomorrow. So all businesses, facilities, activities that are within a certain list must close their premises to the public at 9:30 p.m. and cannot reopen before 5 a.m. That's called the closing period, the mandatory closing period. And most of the stuff that's subject to this would be restaurants, arcades, indoor recreation, any indoor outdoor events, any indoor outdoor theaters, drive-in movie theaters. Joe, we already talked about it. Sports activity, youth and amateur sports activities, golf, recreational boating, outdoor recreational experiences, casinos, horse tracks, and simulcast facilities, driving flight schools, zoos, wildlife reserves, close contact personal services. So that would be your masseuse, your hairdresser, fitness centers, health clubs, and indoor and outdoor pools and museums and cultural centers. So what this means for the restaurants is that at 9:30, anybody doing indoor dining has to leave. If they do have takeout, they can stay open for takeout or delivery, but not for the public. Also at 9:30, all alcohol sales have to stop. And this is at a restaurant, this is at retail, they all have to stop. Retail store operating as convenience or grocery can still remain open after 9:30, but they cannot sell alcohol. And that portion of it, thankfully, that will be enforced by, I guess, the state and the ABCC, which is helpful. And we don't have adult use cannabis sales, but the same thing would apply for that. So those are the three orders, and that's definitely kept me busy this week, kind of piecing between them. The other big, I don't say it was not big order, but the big addition to the mass travel order was adding the state of Connecticut, and us being put on their travel advisory list too. So I've had to do a lot of clarification for businesses. I've had to do a lot of clarification for what it means to our town hall or our employees in town hall. And so if you are a Connecticut resident and you say work for the town of South Lake, which we do have quite a few, you are allowed to come into Massachusetts and work. You don't have to fill out the Massachusetts travel order. You don't have to fill out the Connecticut travel order. You're here for work purposes. You are fine. What it means if you are a Massachusetts resident is that if you go to Connecticut for anything other than grocery shopping, banking, educational purposes, work purposes, health purposes, you would have to go through the travel form and the quarantine process.
even if you stay for less than 24 hours?
Say that again?
Even if you stay for less than 24 hours?
That is a Connecticut order. That has nothing to do with Massachusetts.
No, I understand that, but if you go into Connecticut,
So if you go into Connecticut for less than 24 hours as a Massachusetts resident, you don't have to fill out the Connecticut travel form.
okay,
But if you go into Connecticut for less than 24 hours for leisure purposes as a Massachusetts resident, you have to fill out the Massachusetts travel form. A lot of people are kind of confusing the two because they're two completely separate processes. So even just a lot of simple things like that this has come up this week. I guess I wouldn't say they get quite a few, but the library would get a handful of Connecticut residents, so they're going to have to suspend services to Connecticut residents. That one I really wanted to make sure with, and the state confirmed that yes, they should not be traveling out of their state for that purpose. But it's, it's people are a little confused, but we're just trying to kind of read through everything and make sure everybody's got the best information. I've been working with a lot of departments on how with the new order, how things will change a little bit. I working with Randy Brown with the DPW to ensure that they have what they need to keep the mask order enforced over at the transfer station. I've made up a bunch of new signs that state the order. So those things will have to go in place tomorrow, just to kind of keep things,
So what is the order?
What?
What is the order?
The mask order?
Yeah, what's going to change at the transfer station?
So if you get out of your vehicle and even if there's nobody there, you got to put your mask on. Everybody, and the workers, when they're working in that area, have to have their mask on. Even
Can you come into Connecticut to shop, for instance, at Big Y? Is that okay?
grocery shopping and banking.
Okay.
Yeah. As far as I know, I've tried to find out if does that mean if you wanted to go to dinner in Connecticut? I'm gonna guess with no, but I haven't heard whether or not that applies.
And what happens?
What?
What happens if I have more than 10 people at my house?
Well, are you talking if your neighbor tattles on you or?
Well, yeah, what happens?
I'm assuming they would probably call the police department, and the police department would probably put it on record with me. I haven't decided if it's a letter thing. I'm guessing it's probably a letter thing to start off with, because by the time I get the information, I know the party's going to be over with. And the police department's not going into people's houses to count
Right.
people. So Chief Bishop and I have been talking about it and talking about what, officers are willing to do and not to do. And I'm thinking that maybe a standard boilerplate letter sent to houses, if we do get concerns. I hope we don't, but that's what I'm thinking of as a first line.
Do you do any, during the week, any spot inspections, just walk into places and see what's going on?
Yeah. Just to kind of look around, see if, I honestly see great mask compliance, and if I keep them in my car. I actually have them in here because I would buy some more places because I wanted to make a new signs. So I just kind of go in and, give everybody my card. Give them my signage. I made some new signage that now says the new governor's order. And if they like it, some people like their corporate signs better, and I don't blame them. I'm not the best graphic artist or who can do that sort of thing.
I haven't been to IBS, but have you been there?
I have twice, yeah.
Okay.
I brought back the new signs I made out to them.
Do they have them posted?
I just brought these newest signs to them. They have some different signage that they put up actually. But
Okay.
yeah.
Anything else, Tammy?
I know there's probably a lot else. A lot of, general, this is the first time ever, the last 2 weeks, we get a lot of phone calls about wondering about getting COVID vaccine and things like that, which these aren't real certainties we've had, but I have spent a lot of time looking over our old emergency dispensing site plan, researching the different levels of plans. And the state last week actually did come out with a template for what they think is going to be the release plans for COVID vaccine. And they put together already like a phased approach with public safety being the first line, and then other critical infrastructure agencies being the second that would get it, and then third and fourth would be targeted parts of the population, and then fourth would be all over dispersal. It's gonna look probably not like a traditional emergency dispensing site model, because they have already they've already started like vetting out contracts with pharmacies to put out the vaccine, which the model works really well with the flu vaccine. So it's probably going to be a little bit of everything sprinkled through. Like we'll probably do little clinics here and there. Plus, your healthcare provider will be able to provide it. And then the farm, I think they said it was CVS and Walgreens, which I think is kind of pretty much the two that are left in Massachusetts. So we've been doing a lot of that, having a lot of conversations on that. I'm planning on putting together a sort of like a planning session for dispensing, just because the traditional model of what we normally would do would be a tabletop and everything, but this is so different than how we would normally play the tabletop game, that I just don't think that's the best usage of our time. I think to just sit down and have all of the players in our, have our EOC players, have our unified command, have them all sort of together so that we can kind of see where we stand on that. But on that note, also part of the governor's orders was when I brought this up in the past, they changed the requirements for student age vaccinations, and they added on flu vaccine as a requirement for school. So as part of that, every school age child has to have the vaccination by December 31st. And I worked in conjunction with Marshall Lamoureux to set up a flu clinic. We're having it, CVS is giving out the vaccine. We're having it on November 18th, it's a Wednesday, at Wally Park, 2 to 6. It's going to be rain or shine because it's in the pavilion. So if you have to wait in line, everybody's got to keep themselves warm as best they can. And CVS is actually providing they do online registration, so you can do all of your, you can sign up and put in all of your insurance credentials in there to avoid having to fill out forms and things like that. So I'm really excited about that because we really just need to.
Tammy, that's just for school age children?
No, everyone over the age of 3.
Just for school age children?
Everyone over the age of 3. Anybody.
When is it again?
November 18th.
Who's giving the shots?
CVS. At Wally Park.
Okay, they're doing it. Okay.
6. Yep. It's sort of in the works, but if you go to the town website, and there's a link to the Board of Health's page. I've been working with Jim Middleton, our IT guy, and he started a flu facts page for me, and it has a link to the clinic, and it has a flu facts link to the flu facts page at the state. There's also a vaccine finder website, which I found is really helpful because I've had a lot of people call up and say, where can I get an egg-free vaccine? And you can actually put in by your zip code and click what kind you want, if you want a nasal or whatnot.
Would it be a good idea to put it on a sign at the bank?
I think it's probably already up there.
Okay. Haven't
This
seen
week,
it.
either it's up there or Dennis Clark is putting it up there very soon. And I
Okay.
think he's putting it on maybe on channel 15. So we're peppering it everywhere. It's going everywhere. Get your flu shot if you haven't had it. Prepare yourself for an eventual COVID vaccine. I know there's so much going on. I can't even. It's been a lot to wrap my head around. I'll tell you that. But if there are questions, let me know.
I have a question. Do either you or Kate need any additional help at this point? In the way of manpower to do your job?
Woman power.
Person power. How's that?
Dr. Asia, I would say no, but I'm concerned about the hours. And it's not so much the quantity, it's the quality. So it's hard to say. I can't say, I'm working 50 hours a week, but it's intense work. So I'm working up to, 15, 16, 18 hours a week. But I'm not surprised because of the research. But
So
it's it's very intense, and it can be very weary.
So not to step on your toes, but could you,
Mhm.
could you use any other help?
No, I'm not drowning yet.
Okay, so when you do,
Yep.
don't drown, let us know,
Right.
and I'm sure that we can convince the select board to do something.
Right.
Joe?
And I do refer
I know
to the
your
CTC
answer,
when I
okay.
need to. Yeah.
Okay,
Jerry, whatever you need, like we said before, just let us know and we'll make it work.
Tammy, are you all set with your person power?
It's not person power. I need more brain power, but
You know,
actually, that's never gonna happen. It's been.
Oh.
I think the hardest part really has been just wrapping my brain around everything and responding to all of the calls and all of the emails, and as you know, Karen, our new inspectional services secretary, started. So I feel very bad that I cannot give her sort of 100% to kind of walk her through some of the phone calls that come through, but she really is she's doing an amazing job, and she really still working in that department, I'll tell you. But it's moving along. Today I had my monthly Hampden County Health Coalition meeting, and all the other health departments are feeling the exact pressure on them right now. And some of the towns said that this week was the today itself was the highest number of cases for some of the towns in Hampden County that they've seen in one day since it started. So, I think it's this sort of the same everywhere. We're all kind of feeling the marathon just has not ended yet. It's still there when we leave work and come back in the next morning, and my phone starts ringing around 7 usually with concerns.
But could this be traced back to Halloween 5 days ago, 6 days ago?
I don't think so. I don't think there really was anything very high risk about what happened on Halloween.
I
That
don't think so either. I just asked.
the younger crew that wasn't of the sort of, older getting together partying kind of group of people. These are things that I think it's just starting to come to this point with schools and colleges back in session, with things the way they are, and no one, I don't think anyone is shocked. They've been talking about a second surge this whole time. So, and this is it. This is, I think, the beginning of it. I'd like it to be. And
I believe Westfield State went remote.
2 weeks. Peter, is that right?
Yeah, I believe so.
Yes, until November 18th as of this morning, I believe.
Yeah. Right. So we're not alone. We're not alone. We're all, you know, in different degrees. It's affecting all of us. So that gives me hope.
Sue, how's the hospital doing? Sue?
Our numbers are going up. Our numbers are going up. Did you hear me?
Yeah. Okay. Okay, Tammy, anything else?
Let me think. I'm sure there's more. I'll keep writing it down for the next meeting. I'll tell you that. But that's it for my updates.
Sue, you have any questions? Sue? Can't hear
I
me.
don't have anything else.
Jean?
I don't have it.
Okay, Jean?
No, I'm all set. Thank
He's
you.
on mute.
I'm all set. Thank you.
Okay, I'm all set. Okay, so next meeting is November
19th.
19th. Unless anything comes up, then we'll post it for 48 hours. Okay? All right, thank you, everybody. I take a motion to
Okay.
adjourn.
I'll make a motion to adjourn.
Second, Sue?
Second,
Jerry, yes.
second.
All in
yes.
favor?